Our patients often come to us with complex issues because they haven't had access to health care for whatever reason.
Letting the patients know that you're listening and they're being heard is the first step into developing a relationship.
You want to go to that doctor and just lay it on the line of what you need or what's going on with you. And I want to be able to feel that love, feel that trust, like you genuinely concerned and not like I'm on a conveyor belt.
This is a very agricultural region here in the Delta. It was a very prosperous region back when cotton was king. But then, the mechanization of agriculture also really changed the workforce needs here, and so it left a lot of people without job opportunities. We have high rates of poverty here. We have a lot of very small, very rural communities that really struggle with infrastructure. It's those challenges that gave birth to the things like the blues and the culture and the history that's here.
That's what I am. I am a proud Delta girl. Because my mother did have to work, sometimes we had to choose, okay, how sick are you? Like, I can't miss a day of work. So when patients come in and they talk about these issues, I'm like, yeah, I know. I can definitely see where they're coming from.
You can have a seat here. I got to stay here now.
Okay.
Trust is a really big thing whenever it comes to the patients opening up.
A lot of our population, and rightly so, has had a mistrust of healthcare.
I can learn textbook medicine all day. I can learn how to treat diabetes, how to treat hypertension, but most of it actually comes from social issues. When you touch and listen and actually go and see, like, what are you talking about? Let's see what's going on today.
What sets us apart from traditional private practices is we see patients regardless of their ability to pay. We do have a sliding fee scale. It's based on a patient's income as well as their family size. We look for ways outside of the exam room that we can address health and help remove barriers for our patients to get to good health outcomes.
They don't turn anyone away, whether they have money or not. Whatever care you need, they're gonna make it happen.
A lot of my patients have what we call our Mississippi 3, which is obesity, diabetes, and hypertension.
We are in a food desert. Even though we have all this agricultural land, there's not a lot of farmland being used for produce.
There's no grocery store that you can go and get fresh fruits and vegetables. We have a food garden out in the back that patients can come, they get free fruits and vegetables. Food is medicine.
Anyone can come and pick. We have one rule: take what you need, leave what you don't. And it's amazing how people abide by that. One of the greatest barriers that our patients face is getting to the clinic.
Even if they lived about a mile down the road, access or transportation is a big issue.
Not just transportation, but you have a mom that has 3 children at home and she needs to go see the doctor. Or you have someone that is an hourly employee and they need to see a doctor, but if they take off of work, they're gonna lose those wages. We have to meet patients where they are, and that means going to them. And so we have Saturday clinics where we offer services on Saturdays. We also have just secured a mobile health unit.
We are able to go and set up in those locations and help provide those services.
We had an opportunity to develop an ambassador program. These people are so important because they're people that the community trusts.
Health centers like Delta Health are just so important because of the way they approach complex health challenges. It's a really big challenge, and so you have to really think comprehensively about the patient.
Partnerships that we have with the Pfizer Foundation and Direct Relief is just critical to doing our work.
Direct Relief and Pfizer Foundation are collaborating and working with health centers like Delta Health to enhance resources, from providing essential medications, funding these really important community health initiatives to help close the equity gap in some of the most rural communities in this country.
I really feel like, working here at Delta Health Center, I can make a difference. We can see a patient, and we also find out what's going on in their families, and if we need to get their children in, or if they need dental care. Our philosophy is that we treat the whole person.
My motto, if you could just reach one person in the community, we have succeeded. You do what you can to help everyone.